My name is Pennie Hunt. I'm the Executive Director of Wyoming Health Resources Network in Cheyenne, Wyoming. Our organization is a nonprofit that works to recruit and retain medical professionals all across the state of Wyoming. And I'm here today to talk to you about the challenges with recruitment and retention, as well as share some personal stories of what it's like when a community lacks or is short on surgeons.
How is recruiting? Are you having problems? Are there enough surgeons? Is it difficult to recruit?
Well, I'll enlighten you a little bit about Wyoming, and I do believe that there's a great need in Wyoming for medical professionals of all areas, and specifically in surgeons. Again, our organization is in charge of recruitment and retention efforts for the entire state. Wyoming is one of the largest states geographically, one of the smallest states in population. Recruiting to rural areas is a challenge. Currently, our organization has many surgery vacancies. In the last 3 years, we've held 12 general surgeon vacancies. 6 of these are still open. In the last 3 years, we've held 10 orthopedic surgeon vacancies. 8 of these are still vacant. These may not seem like big numbers to you and to most states, but considering that our Wyoming Healthcare Commission 2008 report stated that we had 25 surgeons in the entire state, we know that at least one of them have left the state, so that leaves 24 surgeons for our entire state. 9 of our 23 counties do not have a surgeon. And 49% of our physicians in general are over the age of 51. So we know that retirement is coming and more may be leaving. We in Wyoming are understanding the difference between need and want. We know that some of our counties cannot support a surgeon in their county, and maybe they want one, but we know that some of them may have to share. The way rural medicine works, many of our hospitals and counties have a surgeon having a home base, and then they satellite out to smaller communities to help cover the surgery needs. I'm going to share a couple personal experiences with you just to show you how this works and the need in our state. 2 years ago, my son needed gallbladder surgery. He lived in a little community in Wyoming that did not have their own surgeon. It was a situation where the surgeon was based in a different community. This was one of the satellite areas. He was put on the list for surgery. So for 3 weeks, he suffered pain from this situation. He missed a lot of work. And finally, he became frustrated, and his mother became more frustrated. Now, knowing that I'm in the health arena of the state, I made some phone calls, found a community that we could transport him to, and have the surgery taken care of. But this was a 3-week process, and this was when I was in the medical community and knew the players. Another personal story, my significant other's daughter-in-law was scheduled next week to have a cesarean. After the cesarean was complete, they had scheduled a surgeon to repair a hernia that she's been suffering with her entire pregnancy. Last week, after suffering some complications, she ended up having the cesarean early. She lives in a community that just lost their surgeon 2 months ago. So instead of having everything taken care of at once, she delivered a healthy baby girl, went home and is recuperating now, but will have to go in for an additional surgery when they can put her on the schedule and have a surgeon available. So instead of having it all taken care of at one time, it makes two trips to the hospital, 2 surgeries, 2 circumstances. Again, these are routine surgeries. They might not seem like big deals, but they are a big deal when it's you. So what happens when these communities are burdened in this way and lacking surgeons and don't have enough surgeons? They rely on locum traveling surgeons to come in. They pull from our 24 other surgeons in the other parts of the state to come in and cover their already busy schedules and come in and cover more communities. And the other thing that happens in Wyoming is that people go to the 4 corners. In Wyoming, that would be Rapid City, South Dakota, Billings, Montana, Denver, Colorado, and Salt Lake City. So the patients go from our state to these urban areas and doubly stress the surgeons in the urban areas that are already stressed. So to answer your question, yes, I think there's a great need. Yes, there's a big challenge in Wyoming, as in all rural areas, to recruit and retain surgeons.